Hi, this is Dr. Kingston, and in this video, we will be talking about the mandibular nerve. We will be describing the divisions and terminal branches of V3, or the mandibular nerve. We'll talk about the modalities they carry and what they innervate. We will talk about which branches are affected by an inferior alveolar nerve block, and we will address which bony openings they use to exit the skull, and which autonomic ganglia and pathways are associated with branches of the mandibular nerve. So just a quick review to start off then. The mandibular nerve is the third division of the trigeminal nerve. And the trigeminal nerve, remember, carries primarily somatic sensory innervation from the face and head. But the mandibular division is a little bit extra in that it also carries some somatic motor innervation for the muscles of mastication. Its somatic sensory territory is shown here in red, so it extends across the chin and lower lip, and then up onto the temple, superficial to the temporalis muscle, and that pterion landmark where the sphenoid, temporal, parietal, and frontal bones all come together. The trunk of V3 exits the skull through foramen ovale. All right, so it's exiting in the middle cranial fossa, coming through foramen ovale, which will carry it inferiorly and directly into the infratemporal fossa. Once it arrives in the infratemporal fossa, as you can see here, it immediately starts giving off branches. The first branches separate the trunk of the nerve into an anterior division and a posterior division. Right near this first division is where we can find the otic ganglion. So in this image, the anterior and posterior divisions have both been lifted up, and you can see the otic ganglion sitting here on the deep surface of the nerves. Now, this is a very lovely looking ganglion. They don't always look this nice or like a little knot at all. Sometimes they just look like the nerve has swollen up or gotten kind of fat. All right, coming back to those divisions. The anterior division is carrying mostly somatic motor fibers. Now, please note that I said mostly, but not all. It's also carrying some somatic sensory fibers that branch off with the buccal nerve. So this nerve right here, and those head down to innervate the buccal mucosa inside the cheek and the posterior gingiva. The rest of these branches, though, are going to be supplying somatic motor to the muscles of mastication. And very helpfully, they have included what muscle they're going to in their names. So we have the deep temporals going to temporalis. We have the masseteric nerve going to masseter. And then we just completely stop trying to come up with names. And we have the nerve to lateral pterygoid going to the lateral pterygoid, and the nerve to medial pterygoid going to the medial pterygoid. And just so there is no confusion here, I wrote it on the slide, but it's worth saying out loud. This donor pictured here has a little variation in where this nerve to medial pterygoid branches from. Typically, this is a branch off the anterior division, but in this individual, it came off the posterior. All right, the posterior division is where we find most of the somatic sensory fibers for V3. These branch off in named nerves, so these are still descriptive for where they're headed, but they're not named for one single structure like the motor nerves. All right, these are the lingual nerve, which is going to head deep to the mandibular ramus here to enter into the oral cavity. The inferior alveolar nerve here, which is going to enter into the mandible through the mandibular foramen and travel through the alveolar process, like so. And finally, we have the auriculotemporal nerve here, which heads posteriorly and superiorly to serve the parotid gland and the skin of the anterior ear and temple. The lingual nerve, recall, is joined here by the chorda tympani. Chorda tympani is a branch of the facial nerve, exits the cranium through the petrotympanic fissure, and then runs anteriorly across the infratemporal fossa to join the lingual nerve. So here it is coming out of the petrotympanic fissure, and it runs down like so to join up with the lingual nerve. It is carrying preganglionic parasympathetic fibers that synapse in the submandibular ganglion, And it is also carrying gustatory fibers or taste special sensory fibers from the anterior 2/3 of the tongue. The sensory territory of the lingual nerve as a whole includes the oral floor and the anterior 2/3 of the tongue as well. The inferior alveolar nerve enters into the mandibular foramen, and then it's going to run through the body of the mandible and distribute sensory fibers to all of the mandibular teeth. Okay, so it comes in here, goes into the mandibular body, runs through here, giving off branches to teeth. All right, so if you wanted to do a mandibular nerve block, if you're looking to numb teeth on the mandibular row here, you want to aim for your inferior alveolar nerve, and that will anesthetize all of your mandibular teeth. All right, so as your inferior alveolar nerve is traveling through your mandible, it is also going to give off a little branch, the mental nerve here, which is going to sneak back out of the mental foramen and onto the face, and that will distribute fibers that carry somatic sensory from the chin and lower lip here. All right, the inferior alveolar nerve is also the reason that we say that the posterior division is mostly carrying somatic sensory fibers. It has a somatic motor component as well that is going to branch off as the nerve to mylohyoid just before the bulk of that inferior alveolar nerve dives into the mandibular foramen. So mylohyoid, remember, is the muscle that defines the inferior border of the oral cavity. It makes a little hammock across the right and left hands of the mandibular body. So somatic motor innervation for the floor of the oral cavity coming via the inferior alveolar nerve to mylohyoid. There are two parasympathetic pathways that are associated with V3, and both of these involve the salivary glands. Now, I know you guys are very familiar with all of these pathways already from previous sessions, but this is the first time that we're actually able to see some of the nerves involved. So let's run through them quickly once again. All right, to get to the sublingual and submandibular glands, parasympathetic innervation originates with the facial nerve. It's going to travel with the facial nerve through the internal acoustic meatus, passes through the geniculate ganglion, and into the facial canal. The chordate tympani branches off inside the facial canal and exits into the tympanic cavity, and then out through the petrotympanic fissure into the infratemporal fossa. In the infratemporal fossa, it hitchhikes with the lingual nerve, which is our branch from V3, and it's going to pass with the lingual nerve into the oral cavity and sublingual space. The fibers, the preganglionic fibers traveling with the chordate tympani will synapse with the submandibular ganglion down in that sublingual space. And then their postganglionic partners will be distributed via the lingual nerve again to the sublingual gland and to the submandibular gland. All right, so here in the infratemporal fossa, we can find where the chordate tympani comes out through that petrotympanic fissure, travels down to join our lingual nerve here, and that will travel anteriorly into the oral cavity and then into the sublingual space. Our second parasympathetic pathway here is for the parotid glands. Preganglionic fibers headed for the parotid glands are going to originate with the glossopharyngeal nerve. The glossopharyngeal nerve exits the cranium through the jugular foramen and then gives off a branch called the tympanic nerve that these fibers will follow. This travels through the tympanic canaliculus with a little bony pathway into the tympanic cavity. It participates in the tympanic plexus of nerves that sits over the promontory in the tympanic cavity, and then kind of reforms into the lesser petrosal nerve. This is going to head into the hiatus for the lesser petrosal nerve, back into the middle cranial cavity, and then out again through foramen ovale along with V3. The preganglionic fibers then will synapse in the otic ganglion, and then their postganglionic buddies are going to jump off on the auriculotemporal nerve and travel up to the parotid gland. All right, so we know that the otic ganglion has its connections with V3 right as it exits foramen ovale, so right in this area here. After they synapse in, those postganglionic fibers are going to write out on the auriculotemporal nerve. And the auriculotemporal nerve has a very specific characteristic relationship with the middle meningeal artery. So this little stump of a thing here is your middle meningeal artery. And as you can see, we've got some auriculotemporal fibers that go posterior to it and some that travel anterior to it. I'm not sure why they do this, but either way, they're going to reform into one solid nerve just posterior to that, and that will carry those postganglionic fibers up here to where the parotid gland would have sat. Now, of course, in this picture, the parotid gland has been removed, and quite thoroughly at that. It's pretty impressive. But it would be sitting right here, anterior and maybe a little inferior to the ear. So these fibers would carry those postganglionics directly to the gland. All right, that brings us to the end. So for your review question, I want you to answer which of the following receives afferent or sensory innervation via a branch of the anterior division of V3. And the correct answer here is B, the buccal mucosa, and that will be coming via the buccal nerve, which was the only sensory branch of the anterior division. And that brings us to the end. Thank you for joining me.